The 12th St. Gallen International Oncology Conference was held in Switzerland from the 16th to the 19th of March. More than 4,200 delegates from all over the world joined the biannual congress focusing on the treatment of early breast cancer. Presentations by well-known specialists were held about the biology of breast cancer and adjuvant systemic treatment of individual patients. As a result, an international expert panel of 46 clinicians discussed new guidelines in breast cancer treatment, including the latest developments in this field. Sysmex arranged an information forum about the OSNA method, a molecular technique to detect lymph node metastases, with a booth in the exhibition area. Additionally, there were poster presentations from 3 out of the 100 OSNA users across Europe. One rather controversial topic discussed during the conference was the treatment of patients with positive sentinel lymph nodes and the impact of the Z0011 study. OSNA may contribute to a better understanding of size of nodal metastases and its clinical relevance.
This clinical randomized study was not able to reach the number or the accrual of patients that they have been established. So unfortunately, the study was closed prematurely. So the results of this study are not reliable. There is a general agreement that the macrometastasis has to be submitted to axillary lymph node disease. But for micrometastasis, there is no general agreement whether the axillary lymph node dissection is useful or not.
The use of OSNA for molecular analysis of the sentinel lymph node will help to solve the problem, because we will have a more precise evaluation of the tumor burden within the lymph node, so to know exactly what the presence of micrometastasis means, and this will help to decide if whether or not to perform axillary dissection to patients. So I am very hopeful regarding the use of molecular analysis of the sentinel lymph node.
We have now new changes in practice.
The conference was considered to be an excellent platform for the second meeting of the European OSNA User Club, which was established in 2010 during the EBCC in Barcelona. One of the main targets of the User Club is the exchange of experience at an international level between the different countries where OSNA is already in routine use, and the subsequent dissemination of those activities on a national level. Different scientific and clinical topics were discussed and proposals made for potential future projects. Establishment of a European database was one of the topics on which there was an overall consensus.
If we can have a database used by all European users of the OSNA Club, beside the standardization of the Sentinel node, then we can have in a very short time a large number of patients identified with plenty of data to make a very robust work with very good results.
In addition to the database, there was discussion about the important topic of guideline modification at both European and national levels.
The Spanish breast working group has already met several times making guidelines to work on the sentinel lymph node. One of the arrangements we have accomplished has been to have the molecular procedure as the first option. The better way to evaluate the lymph node is with the OSNA procedure. If we are not able to have, or the hospital is not able to do so, then other procedures are also acceptable, but we consider then that they are not so good as the OSNA procedure.
We have already had a meeting with the European Working Group for Breast Cancer Screening Pathology, where we have discussed the use of molecular analysis for sentinel lymph node. And we know that into the present TNM classification, the molecular analysis is not considered with the possibility to use a quantitative evaluation. That's why we would like to introduce the possibility to classify the lymph node with the TNM classification. In Italy, we can introduce the use of molecular analysis also for the national guideline. We have already done it in the regional set, and Oncology Web has adopted the possibility to use OSNA for staging the Sentinel lymph node.